Hello, everybody, and welcome to Your Voice Talk Show, our interactive talk show where your voice matters. And for those that are tuning in for the first time, my name is Sonia Graham. I am the author of It's Time to Uncover Your Original Blueprint, which entails 10 steps to rediscover the real you and your purpose. So if you would love to pick up the book, I would love you to pick it up. You can pick it up at Barnes and Noble online, Target online, Walmart online, and Amazon. And if you don't know, for an author, the best thing you can do also, other than purchasing the book, is leaving a review. So let's get into this show. This is a topic that is so important. You know, the news reports some things and you get some takeaways, but I really wanted people to really know when they talk about the numbers at the hospital and emergency room. So this topic today is the state of the emergency rooms. And the amazing thing is we have two amazing guests that actually will give us a bird's eye view because they are right in the emergency rooms. And in this case, we're very fortunate to have two professionals that are literally at the number one trauma center in the nation, and we'll get more into that. So I want to go ahead without further ado and introduce you to these our healthcare professionals that are with us today. We're so excited. The first person that I would like to bring on would be William. William actually is William David, and I'd like to read you his bio. He's been an administrative director for the emergency department and psychiatric service at Harris Health's Bentop Hospital since 2010. Bentop Hospital is a 402-bed level 1 trauma center with a comprehensive stroke center, accredited chest pain center, and an academic teaching hospital affiliated with Baylor College of Medicine. William attended Western Australia School of Nursing in 1989 and earned an MBA in Healthcare Administration in 2006. He brings over 30 years of nursing experience in some of the most challenging clinical environments. For nearly a decade, he was the director of Memorial Hermann Hospital Life Flight Program and Emergency Services. William also is passionate about sharing his knowledge and experience. He is a course director for TNCC, ENPC, ATCN, and course coordinator for ATLS. His dedication to the field of nursing has not gone unnoticed. He was recently highlighted in the Houston Chronicle Salute to Nurses, 2020's top nurse leaders. So welcome to the show, Will. We're going to call you Will today, right?
Yeah, that's right, Sonia. And thank you so much for inviting me onto the show. It's just an absolute pleasure to be here. It's very exciting. Thank you.
It's our pleasure to have you here with us. And so now we're going to go ahead and introduce your colleague, Mr. Jonathan.
Hello.
So we also have joining us Jonathan Garcia. He is a ER nurse with 7 years of experience, and he serves as an ER nurse manager. Jonathan is from El Paso, Texas, and graduated with a BSN in 2014. He is currently enrolled in a double master program with UT Tyler for a MSN MBA, and he is also with Bentop as well, right, Jonathan? Bentop General Hospital. Welcome to the show also, Jonathan.
Hello. Good afternoon. Thank you for having me.
Wow, you know what? There's one thing to talk about something, but to talk about something with people that are really there and that can give us that insight to what's really going on. You know, so I'm really glad to have you guys today. If I can ask, Will, what got you interested in being in the healthcare profession?
Well, that was as you can tell, that was a long time ago, Sonia. Over 30 years ago, I was in Perth, Western Australia, and my unfortunately, my mother was dying of cancer. And at the time, I was working construction, and I used to get off work and I'd walk to the inner city, down from where I was working. And I'd just go in and see her, and she was in the hospital for like a month. And those nurses were sort of surrounding her and being so kind to her. And I watched it and I thought, what a meaningful job they had, And, it just really was overwhelming for me. And then within about a year, I was enrolled in nursing school. So that's how I sort of started. I loved construction. I actually missed that, but it was when I saw what they were doing, it was just, it was so meaningful and compassionate. That's why I did it. And then I've done it for, never turned back. Yeah. Very rewarding.
That's awesome. Well, us and many people are very grateful that you chose the path. And how about you, Jonathan? What interests you in the healthcare field?
So what got me into nursing was actually somewhat similar to Will. My grandmother was very ill because of diabetes and other comorbidities. And so we often had to visit the emergency department. I spent a lot of time there. I spent a lot of time upstairs in the med-surg, telemetry units, and ICU. And there was always one constant. And there was one nurse that I would see often. She served as an inspiration. She was the only one that ever made my grandmother feel healthy, feel like herself again. And so that was inspirational to know that as much as my grandmother had been suffering, there was somebody out there with nursing that could help her be who she really is. And so when the opportunity and a new nursing school opened up in my city, I graduated right on time and was able to be one of the first classes that started and graduated from that new school. So ever since then, I moved to Houston, been working at Ben Taub ever since, and it's just been absolutely wonderful.
Wow. Well, that is awesome. Well, that goes to show you that we're all created differently. Because I'll tell you what, I know you guys experience seeing blood and lots of other things, and I would be passed out on the floor at the first sight. So I'm thankful for you. I would not do
It's
well
tough,
with those.
yeah.
But
You do get used to it, son.
Are you guys of course have seen plenty of that, I'm sure, right?
Yeah, over the years,
Yeah.
for sure. And it really does still impact you, and you've got to make sure you do a lot of self-care, but you've got to sort of get down and try and make a difference in moments and minutes. So it's important, to keep your composure and just do it.
That's awesome. Well, yeah, you guys do an amazing job. So the state of the emergency rooms today, you guys know just as well as I do, is that you see so many reports on the news, and they report some of it. But one of the things that I think that, you guys are people. There's people serving people that are human and experience some of the things that we all experience, but you're still expected to perform at this high level on a daily basis. So one of my questions would be, of course, we're in this pandemic era and COVID is a big factor. So when it comes to your personal journey with walking into those emergency rooms on a daily basis, how do you deal with what fear you may have, or do you have fear of the virus, and does that change how you go to work when you do work? How has this pandemic affected you mentally with how you walk in and you start your day? I guess is a good way to put it.
Yeah, that's a great question, Sonia. I think in the early days, Jonathan might support me on this. We had a lot of fear because there was a lot of unknowns, and 18 months ago, our supply chain of PPE was not great. We were concerned on a daily basis: would we have enough PPE, protective equipment to keep ourselves safe? We were recycling our PPE. And that's changed. The supply chains are a lot stronger. We have enough PPE. So I don't feel a lot of fear anymore. I mean, we've also got the vaccine, which has made a huge difference. So it's just been going a long time. I think that's one of the challenges. I watch our staff getting more and more sort of stressed because of it's nearly 20 months now. But I, you know, it's changed along the way, and it's developed, and we've learned a lot more about this virus. So it's very different to what it was when it first started. You know, we know a lot more. We're safe. I think we're safer now. But Jonathan might have some thoughts as well on that.
Yeah, I mean, I totally agree. Well, the unknown was what was the scariest. We've dealt with contagions before. It's not like we have not had tuberculosis before or other airborne illnesses or contact droplet illnesses that we've had to isolate before. We've gone through Ebola trainings a couple years ago. And so it was concerning seeing it develop uh, globally and just how fast it was spreading. And the supply chain that was very, very concerning because a couple months ago, or I guess a year, 2 years ago, we were tossing our PPE equipment left and right after every single use. And so that was what we've been trained on for many, many years. And to have to change all of that because of supply chain was very, very scary. And so it has taken a toll on the healthcare professionals' morale, their mental health. But working at Bentab, I mean, just when I started there, I was able to meet such tough nurses. They're so tenacious. They've dealt with everything and everyone. And so it was not as scary knowing that we were just a solid group of nurses, um, heading into this and just going together as a team. And so now we are more resilient because we've gone through a global pandemic. We've dealt with that and what we were dealing with on a daily basis as is. And so I think we've come out a lot stronger. We still have some time that we need to dedicate to our mental health, right? And refreshing and resting once this has really, really dwindled down. But we will definitely be a lot stronger when that happens.
Awesome. What are some misconceptions that you guys would like to dismiss maybe today in this broadcast? Is there something that sticks out and every time you hear it on the news and you go, that's not true, or it's not mentioned in the proper contents? Is there anything that you would like to clarify?
I think that we're still in the middle of this. You know, there's people. I think there was a great hope that we'd get all. You know, the vaccine would resolve this pandemic by now, and it really hasn't. We're still seeing a lot of patients come in. They're coming in sicker. That if you think you need to come to the hospital, you really should. You know, if you're having shortness of breath and you're having difficulties, I know some people, well, I don't want to overwhelm the system, but we find a lot of people leave it too late. You know, and I don't mean if you've just got flu symptoms. I mean, if you're really having trouble with your breathing, etc., you need to come to the hospital earlier rather than later, and you shouldn't put all your concerns on back burner. You know, like if you're a diabetic, you know. You need to make sure you're looking after yourself. And if you're having trouble, come to the hospital because we're still very safe. And we're going to keep you safe when you get there. And we're going to keep you away from getting exposed to anything. But you really need to look after your concerns. We've had people who haven't called for an ambulance because they're having chest pain. And they need to call. You know, you need to come to the hospital. Don't put your healthcare concerns on the back burner because you think you're going to sort of impact the system too much.
Mm-hmm. Something. I mean, I feel like vaccines has been in the news a whole lot, and there's a lot of misinformation on there. So much time has been dedicated to that. The two things that I actually don't think are being talked about enough are actually the long-term effects of COVID, because we have individuals that are currently suffering from the first wave of COVID. They're suffering from lung injuries. They're suffering from epilepsy, other mental health. We have so many disturbances in our community because of COVID that they're going to be there for years to come. COVID has destabilized so many individuals' lives. It has it really has destabilized so many individuals, even just income, and that has resulted in gaps in their health care. That goes along with what Will was saying, in that people are holding off on certain things, and so the chronic conditions are going to be they're going to be in a much worse shape. Um, it's going to be very difficult, but I do think that there needs to be some vision of the future and how we're going to respond to that, because
Mhm.
the workforce as it's getting tough, right? And the amount of patients that are going to need our help after COVID are going to be there.
And do you feel that a lot of the, or not do you feel, but do you see more unvaccinated people when it comes, or is that still, because that's what the news says, that there's more unvaccinated people that are admitted than people that are vaccinated?
Hmm.
I think, yeah, I think, Sonia, what we see, I think Jonathan will agree with me, is that we see the unvaccinated people getting sicker. You know, if you get vaccinated, you still seem to, people, we've had staff members who have been fully vaccinated and get positive COVID tests, but some of them don't even feel unwell at all. The folks we seem to see in the ICU, the patients tend to be patients who weren't vaccinated.
Got it.
Right.
So,
Well,
so then it is true that you can still have test positive for COVID after being fully vaccinated. However, when they say that the chances, I guess, are better for your survival or being very sick, that you would be without being vaccinated. That is holding true based on what you guys are seeing.
absolutely.
Absolutely, yeah.
That's interesting.
And we've
'Cause
just
I
gone
know.
through we just started having our booster shots, Sonia. So we're fully committed to doing the vaccinations, because we first got ours. I think Jonathan was the same time as me, like back in January or December of last year. So we started, we're sort of meeting the criteria for booster shots now, and we sort of encourage people to do that as well. Now, a lot of people in the community got it later than December. They might have got it in March or April, but healthcare workers were one of the first group, to get the vaccine.
Okay. And then I wanted to ask you questions as far as beds being available. I personally experienced this a couple of weeks ago. My father was having, he's anemic, so he was having low blood pressure issues. And he was sent to, or they told him to go to the emergency room. And I believe, it's safe to say that it depends on what area you're at as far as how hard the hospitals possibly are being hit too. And this particular hospital, there seemed to be like nonstop with the ambulance coming and dropping people off, left, flat landing, and there are people actually lined up to go into the emergency room. In his case, he was there for 35 hours, and they had like beds in the hallway, and he received a blood transfusion in one of these beds in the hallway. And after 35 hours, there's still 50 people ahead of him and waiting for an inpatient bed. So that's the other part, depending on the hospital, that I don't think people really understand, that whether it's COVID related or non-COVID related, it's putting a great strain on the emergency room. Can you guys speak to that?
Yes, it really is. And so we are constantly having more than 20 patients admitted in the emergency department and waiting to go upstairs. And so it basically creates this funnel, or this bottleneck effect back into our waiting room, right? And so a lot of those individuals may have been holding off for a few days, a few weeks. And so it does create a big dilemma, because the patients that are upstairs have every right to receive a full treatment, and they do. And that's why sometimes it takes a while for us to get those beds. But it is an everyday struggle all across the nation.
Yeah, and Sonia, we call it throughput. We put a lot of energy into throughput because we're trying to get our patients from the EC up to the inpatient bed where they get care. But we've come up with different strategies to sort of help people. And I don't think this would happen to was it your father who was sick? I don't think this would happen to him because he seems like he needed to be admitted. But we see a lot of people in the waiting room where we try to treat them in the waiting room and discharge them. We'll do imaging, we'll get lab work, we'll really give them a full workup and discharge them because we're trying to stop that sort of giving them a bed that maybe we can avoid having to give. But it's a real challenge, and it's an everyday focus. And when people are well, and we try to discharge them as fast as we can, a safe discharge, so that we can open up those beds. But what you experienced, unfortunately, we see all around the city. And we've had to contract some beds down at another hospital because we don't have enough beds on a daily basis to treat all the patients that we have.
So at this time,
but if you're really sick, we're going to get you to the right care, the right time. That's unfortunate because if you're not so sick, then you get pushed back. You're waiting.
Yeah, so. and I believe he was being treated, and I think the thing that happened was after the time, if you imagine if it was that overwhelmed, staff is only, if it's 6 people, it's 6 people, and if you have 10, 20 people to each person, it's just almost impossible to give the service that people may have been accustomed to before pandemic. And so in this case, he was saying that he hadn't eaten or anything the time that he'd been there. But, if you're in a regular room, then there's a different protocol on how you're treated. So it's a lot of things going on. And that's why another reason I want to do this show, just so people can understand that it's not, you can't place the blame on the people doing the work. They're doing the best they can. And I want people to understand the strain and stress and the morale that happens with the people on a daily basis that go past themselves on a daily basis to put themselves at risk and to serve our community. Today is the first day of the celebration of Emergency Room Nurse Week. And so that's another reason that I wanted to draw attention to that, because I think it's very important that you make a choice outside of yourself, a very unselfish choice, to sacrifice yourselves on a daily basis. And with that, when a person arrives at the emergency room, I know a lot of times it's a dire situation, but sometimes we all need grace at this time. We all need that extra grace and patience that can be extended to mankind in general. Can you walk us through what that would look like? A person, the process if they arrive at the hospital with COVID, because many people say that it's a very lonely road because they drop you off, security escort you in, and you don't see anybody. You don't even have contact with, every now and then if you get a message from the provider, what's going on. Can you kind of give me an idea of really what that means or looks like?
Yeah, Sonia, we put things into place to where when you come to the emergency room at triage, which is a word for where we sort people, if we think you're someone who maybe have COVID, even though we treat everyone like they have when we first see someone, we treat them all the same. But then if you're showing certain signs and symptoms that we think there's a possibility you are infected, then you go to a different route and you're in a more isolated area. But our nurses are all there and they're caring for you, but they'll have their full PPE on. And you may not be positive, but we have to assume you are. We've done a lot of things to help people not feel isolated. We've got iPads. A lot of staff donated iPads where we can let people communicate with loved ones through iPads. We've just loosened up our visitation policy again. It was pretty stringent up till about a week ago, And now we've been able to loosen that up again, which is great. But when we had so many positives in the hospital, it was very challenging. But it is lonely, and that's where the nurse becomes so important, because you may be the human contact that matters, because they are isolated from their family, and using that and just giving that sort of personal touch and setting up the iPad and sort of doing those things that can make a difference is important. It's so important right now. But
awesome.
Yeah, if you're a trauma, a big trauma that's gone down, or you're having a heart attack, or you're having a stroke, you're going straight back to the critical care area, and you're not stopping anywhere, or say you're having respiratory distress, you're going straight back. So those sort of conditions are getting the focus they need, and they're getting immediate care. So Jonathan might want to elaborate. He's more close to the staff.
Yeah, we've essentially created a split process, and so we try and cohort them. But yeah, the technology has been great for us. Even maybe if the iPads are all currently being used, which we have quite a few, but it also helps out that the patients have their iPhones and they're able to video chat with their loved ones via Snapchat, WhatsApp, Instagram, and social media has really helped a lot of patients just kind of keep their sanity in these rooms.
Yeah, technology's been a friend.
Yes. Sorry. That's really good to know. And technology has helped us in so many ways. You look at us right now. This has changed the way we do a lot of things. And so to know that you guys are taking the time to do everything you can to give them that contact, because that's everything with healing. Is just, we're people. We're used to having that contact, whether it be physical or emotional, contact with people, with our loved ones. And I think that assists with the healing, the healing process.
Absolutely.
So it looks like we have some questions in the gallery. Tracy, can we go ahead and open up and answer some of our questions and get some of the feedback? This is an interactive show, so we definitely want them to be a part of the conversation.
Yes, we have at least, looks like maybe four question comments. Our first one's from Michael Winfrey. The question is,
Okay,
what are your thoughts? What are your
Can you pop it up
thoughts?
here so we can see it too?
Uh-huh.
Okay.
What are your thoughts about government leaders removing mask mandates?
So this is definitely a controversial question, but I think that if the local governments were to have more healthcare professionals in their cabinet or in their as advisors, I think that the removal of mask mandates would not be such a big controversy, because I think that as a healthcare professional, the majority support something like that. We want to practice evidence-based care, evidence-based medicine, and we want to use every single tool that we have, no matter how simple, to fight this battle, right? It's a global pandemic that has ravaged the world. And so every single tool, every treatment, anything that we can do is something that we're going to want to do. At the end of the day, we want to help people. And so I think if they involved a bit more healthcare professionals, I think things would have gone just a little different.
Yeah, I can see that. Do we have any more questions?
Yes. Our next question is from Raynell Winfrey. The question is, can an emergency room hospital legally turn away a patient who has come to ER in ambulance because of severity of symptoms?
No, they certainly cannot. There's federal laws, one called EMTALA, which is the Emergency Medical Treatment and Labor Act, and it's a federal law. It's been in place since 1986, I think. And if you present in an emergency room, you must be accepted and you must have a medical screening exam by a provider, whether it's a physician or a mid-level nurse provider. You must have that exam by law, and you cannot turn away an ambulance. It doesn't matter how busy we are, if we've got patients boarding in hallways, no ambulance can be turned away from an emergency room who's part of the Medicare, Medicaid structure in this in the United States.
Awesome.
It's a wonderful law that allows, makes everyone at any time be able to get health care they need.
Wow, that's a good question.
Let's see, we've got one comment here from Mr. Farrell Phelps. Great segment. Giselle Johnson commented, as a chaplain resident there, I've been blessed to offer spiritual and emotional support to patients. So it sounds like Giselle is also a Ben Taub. Yes.
Thank you, Giselle, because our chaplains just make all the difference on those busy days, because sometimes you're rushing around and you're very, very busy and you may not have time to do that human piece as much as you'd like. And the chaplains step in and fill that void. We've got some great chaplains. So
Thank you.
That's wonderful to hear.
Okay.
Awesome.
And there's another question from Tony McClammy. Why are people dying when they have had the vaccinations?
So I've seen some numbers. It's a very, very small percentage of folks that have been vaccinated and overall individuals that have been hospitalized. But there's definitely more information that is missing, right? Because a number will just be that. It'll say one person has passed away with COVID while being vaccinated. However, they do not disclose, because of privacy laws, what else was going on with the patient, right? And so they could have had uncontrolled hypertension. That could have led to a significant cardiac event. They could have had some lung-related issues from COPD, other chronic issues that are not reported. And so then it is a little misleading. We've known that the vaccine is not 100% protective. It is not going to be the silver bullet, but it is definitely, and we can see it in the research and the statistics currently, it is the most effective.
Okay. And we have one other question here from Farrell Phelps. How do you feel about being forced to take the vaccine in order to keep their jobs?
Yeah, that's at Ben Taub at the moment. It's not mandated, but there's many hospitals in the medical center that have moved to mandated vaccines. I think it's all coming in the future. My sense is, I know there is an offer that you could get tested regularly if you don't take the vaccine. I think that's good, because there is some people who have some religious thoughts about taking vaccines. I'd hate to lose a lot of these very, very talented individuals because they have religious views on whether they want to take something. It's a difficult question. I don't have any problem doing it. Most of my staff seem very eager to get the vaccine. They know how important it is. But yeah, that's a real concern right now around the medical center. And we'll see where that goes. I think it is going to be mandated in the very near future.
Okay.
And a question I wanted to ask before we move on to the next question. I've heard the definition of booster or third dose. Can you guys clarify what that is? Is it the same shot? Or is it a different shot?
It's the same. It's exactly the same shot. No different. Same dose, same shot. It's only for Pfizer at the moment. I mean, Moderna's working on it. And so anyone who had the Pfizer early, at about 6 months, they're saying now it's the time where it's probably beneficial to have the booster. And I saw the president had that, 2 or 3 weeks ago. Most of my staff have had that booster, and it seems like your immunity starts to wane a little at about 6 to 7 months is what we're sort of seeing. And so that's why it's now come out to have encouraging people to have the booster shot if they're at that 6 month mark. But if you're 2 or 3 months out of having your 2 shots, your immunity is still really strong.
Gotcha.
Okay. I have a couple of more from looks like some fellow nurses. Rhonda Wynn, who's a travel nurse, says, "I see it all. You guys are giving great answers and good information."
Thank you for traveling, Rhonda.
Yeah. I hope you're traveling to Houston, Rhonda. We need you.
Yes.
And Minister Terry Arthur, who has now is a retired ICU nurse for over 35 years of experience, and says, "I can understand how important and overwhelming it is in ICU." Her next comment, though, says, "I recognize that the vaccine because it protects not just you, but your family."
Mm-hmm.
Yeah, and that's why great comment, Minister Terry, because that's what we've sort of noticed was that it's not just about you, it's your parents, your grandparents, your loved ones, because you can carry this virus and not show symptoms. And so it's really, if you can get vaccinated, you're helping everyone around you. So that's why we encourage it so much. We offer it in the emergency room. We don't offer it for you just to come and get the vaccine, but if you're there for another reason, say you're having some sort of diabetes issue or whatever, we'll offer you the vaccine. So we're not a vaccine place, but we do offer it for all patients who visit the emergency room.
Yeah,
and we encourage
it.
Yeah.
What were you going to say, Jonathan?
Thank you for joining the video chat, Minister Terry. As an ICU nurse, I know you feel our challenges. I know you feel our struggles, and just how complex all of these issues have turned out to be. When really one of the easiest things you can do is get that vaccine. I just got the booster on Tuesday of this past week, and apart from a little bit of arm soreness, everything has been just fine. Been able to go to work, no issues. That's the same way it was for me on the previous 2 vaccines. And so everybody does respond a bit differently, but it was very easy. I just signed up and sat down, got a shot, and that was it.
And Minister Terry, thanks for 35 years as an ICU nurse. That is quite an accomplishment. That's a strong person there to do 35 years in ICU. So
that's a long time.
Oh, yeah.
Yes, absolutely, for sure. So, guys, I had another question. I wanted to find out, because there's a lot of misconception with the ages that are affected by COVID. What do you guys see? What types, as far as the degrees of how they're affected? Does age have anything to do that? What are you guys seeing?
It seemed like there was, in the early stages, there was individuals, say 60 years and up, being affected quite a bit, and it was very concerning because they were still relatively healthy. They just got they caught COVID, and so that changed things up quite a bit for them. And so most recently with Delta, we were seeing a lot of younger individuals, individuals ages 20 to 45, a lot of that, and some of them were very, very sick, needing to go to ICU, needing all sorts of transfusions, even ECMO in some hospitals. It was very, very concerning that the impact on the age groups changed And also there was a lot more pediatric cases. I know there was Delta was kind of surging when school started, and so it only makes sense. And also to consider the fact that there was no vaccine for school-age
Right.
children or those under the age of 12. So it all makes sense looking back, but it's unfortunate that it kind of just attacked one group with each wave.
So with that being said, it appears that you really can't look at that now because we've got two different variants that we've been exposed to. And so therefore, it doesn't matter if you're in the 60s or if you're younger, then you still should have the same concerns. Is that what you're saying?
Absolutely.
Gotcha. And what about the people that are, like you, I guess they call them the long haulers, the people that were affected by COVID? Are you seeing a difference in ages as far as those people that are coming to the emergency room now to get help?
I think some of the data is still coming out on long COVID because we haven't been in this that long. But it seems like from what I was, looking at the data, it's like 20% of people end up with long COVID. So they have a long period of symptoms that are kind of distressing. And there's also some mental health symptoms and some depression, feelings of fear and for the future. So it's a very complex disease, and we're going to know a lot more about it over the next few years, because it's not going away. It's kind of something we've got to live with for quite some time.
Wow. So even if you've been affected by it, it's
but we've really
term.
come a long way. So, we've come so far, Sonia. I remember in February of 2019, we tested a person for COVID, and she was a young lady, and we'd just been hearing it come out. Our chief medical officer, Dr. Barnes, was there, and our infectious disease chief of infectious disease was there, and we swabbed this young lady and for COVID, and we had to send that swab to Atlanta to get tested. So it was 4 days later we find out, right? So now we get our results back in an hour. It's such a different landscape now. So it's so much better than it was back in 2020. It was February 2020, and it went to Atlanta. And now you can buy it. So we've come a long way, and I think that those leaps and bounds in our understanding of the disease will be better for all of us in the future.
That's awesome. What about staffing? How is this pandemic affecting the staffing of the emergency room?
That's right up my alley, Sonia. It has been very complicated because we've also attempted to try and approach it from a very understanding leadership dynamic where we know from one day to the next, individuals start feeling symptomatic. We plan to have them for their shifts during the week, and suddenly their kids are sick, and maybe they're the only parent. And so then while they are still healthy, they have no other option. We've had things like that. We've had individuals leave to travel. But fortunately, we have had a lot of support from the state. We have received several nurses who have done multiple 13-week contracts with us. And so they've helped us fill in those gaps. And we've also had some of our super awesome staff that have stuck it through with our team that are really, really dedicated to this community. And they have been our backbone throughout all of this because they were able to help guide all of these contract and temporary staff to our department, have them understand how we do things in our department. Because while they are experienced, we want to make sure that the processes are being followed, right? And so it's been very complicated. We've shuffled a lot around, and we've made tons of accommodations to also try and keep our staffs as satisfied as possible, considering the conditions. But so far, we've been able to remain with safe staffing. It's taken a lot of work,
Wow.
but we're doing
Well,
okay.
some of the challenges, Sonia, was like staff, our very talented staff, because it takes a long time to train them up to be where they are, and they're just dynamic. They make things happen so well. But they're being lured away by these contracts, in other states, and they were lured away for good reason. Sometimes, some of them, their partners lost their job, so it was very good to them to be able to go and get a high-paying job in New York or LA or something like that. I had one nurse who left because she was putting her sister through medical school, and this was a big opportunity. She could make more money in LA than she could make here, twice as much. And so we were losing really good qualified staff, but our really loyal ones, and the reason I don't say loyal, because I don't blame some of our nurses who left, because I really feel like they were offered something that was hard to turn down. But these nurses, the Harris Health System put some retention bonuses in place. Our executive team was so supportive. They knew we needed to keep that hardcore group who, if you get a big trauma and you need somebody who knows all our processes, who can always just land on their feet and make things happen. And so that's where I think Harris Health stepped up and really thought outside the box and really put things in place to retain our most valuable resource, which is our nurses. So I do commend them for that. They did more than probably any hospital in the city, I think, to help retain our nurses.
That's awesome. That's part of it. It's more than just wanting something and needing something, but actually putting something forth to make it happen, to show that value. Making it where people will say, okay, I see the value, not only them, seeing how valuable I am, but making it worth my while to make that commitment even further. So that's very commendable. That's awesome. That's very awesome. Another question that came in prior to the show, a person, you hear about intubation a lot, and for some of my viewers, they may not really know what that means or entails. Can you kind of tell us what determines if a person needs to be intubated and what that looks like, please?
Yeah, that's people come into the hospital. They could, some people, it's very obvious. You're going to be intubated the minute you come through the door, right? And that's where they put a breathing tube down into your trachea, so down into your lungs, and we will assist you breathing on a ventilator, where the ventilator will breathe for you, and it's life-saving. And sometimes patients come in, and especially COVID patients, if they're really, really not oxygenating well, they can't ventilate, then we may have to do that. That's not what happens most of the time. Most of the time, people come in, they're having some respiratory distress, and we may be able to give them supplemental oxygen, and they maintain their respiratory effort, and the amount of oxygen saturated in their blood stays at a good level that we know is okay, and that they can maintain their respiratory function. Or we'll draw blood levels and say, no, it's time. We've allowed them not to be intubated for a period of time, hoping that they'll sort of get over that period with supplemental oxygen, and we have to intubate somebody. So it's sort of the last effort we do, but we don't want to leave it too late. We want to do it when it's ready, when they're ready for that. But we're having a lot of success with high flow oxygen with COVID patients. So that's helping a lot. Whereas years ago, everyone would get intubated. Nowadays, the high flow oxygen has made a big improvement. Jonathan might want to elaborate on that too.
Yeah, I mean, that's a difficult question as far as like when somebody is, and I would not expect a lot of non-medical folks to understand, just because I know in the news they've discussed a lot about ventilators and a shortage of ventilators, and you see images of people in the ICU being intubated. But just like Will mentioned, we've found other alternatives to actually ward up. They're warding off intubation. They're allowing the medical team to evaluate, gives them more time to evaluate whether it would be beneficial or not. And it is the last option that we want to go with. But if somebody is in that respiratory failure, then that's something that the physicians will go ahead and decide. You're pretty sick at that point.
Gotcha. I actually have a question from a text question that came in. It says, as a long hauler with the booster shot, what do you think of having the something antibiotic? I can't read it. Monoclonal antibiotic injection
Monoclonal.
only,
Mhm.
and you only. Can you say it pronounce it properly? I didn't want to mess it
The
up.
monoclonal antibody infusion.
Uh-huh. So I
So
guess the
she,
question was,
Yeah.
what do you think about having that injection, if they already have the booster as well?
I believe you still can receive it, but of course, I think that if she were to become symptomatic and she's referred to that, it has really helped out so many people. It has
Yeah.
been one of those therapies that has prevented some individuals from ending up in the emergency department, potentially in the ICU. And so, if that's something that is recommended by a physician, definitely heed their medical advice.
So that's a treatment for somebody that's already had COVID, or is that what that is? It's like a treatment?
Yeah.
If she happens to be experiencing COVID symptoms and is positive, it would be for that. Yes, ma'am.
Okay, got it. Very interesting. I've never heard that. That was a very good question.
Yeah, it's
Like-
proven to be very beneficial. And we do it at Bent Hub, and they do it at, I think, most hospitals in the medical center now.
Awesome. Yeah, I had never, let me see if I got any text questions. I think that's the only text question I have there. All right. So we do want to make sure we open it up. If you guys have any questions, please go ahead and put your comments in the chat or text the number there.
We have
our
some-
text number
We have
is
some questions on you.
awesome.
Okay. Let me ask this from Mr. Michael Winfrey. Let me show his question on screen for you guys. The question is, where do the homeless population fall in the numbers being shared? An example for vaccine and positive results.
I know I don't really have that data. It's a great question, Michael, and it's an important question. We do offer the vaccine and to tell you the truth, we weren't offering the vaccine to everybody, but we were offering it to our homeless population because we really felt they were vulnerable earlier on when the vaccine first came out. Now we offer it to everybody, but we did see them as a group who a vulnerable group early, and we were offering it to them because they really do struggle out there, and we're seeing more and more homeless come through our emergency room. We're seeing more and more mental health people with mental health issues coming through our emergency room. That volume's up like 30% since this pandemic started. If we compare our numbers to 2019 to now, it's a 30% increase in that volume. So they're a vulnerable group that we do target. We do have a homeless van that does go around the city. Look, they know where a lot of the homeless people are sort of being and trying to sort of survive, and so they do know them, and they do go around and offer help. So we're doing a lot. There's a lot. We can always do more, but we're doing what we can to help the homeless, and we do see them every day in our emergency room. We've actually got a program going now where we try to some of the homeless patients who come in. We've set one homeless gentleman up with an apartment, and he used to visit us 2 or 3 times a week, and now he's very happy in his apartment. So there's a lot of good things that we've been able to do. We did send some of the homeless folks to a motel that we had sort of had a contract with, and that was working well. That's still going as well. So that's some of the strategies we're doing to help the homeless. There's awesome. always could be more though, because it's a big problem in Houston.
Wow.
Well said, Will.
Okay. There's a comment from Giselle Johnson, and she says, I have a COVID unit that I care for. We must continue to pray for the staff. I've talked to nurses who have told me that they pray fervently because they never know what the day may bring for them. Let's see.
Thank you, Giselle. Thank you for that. Because as much as we may have medical training and even training on how to nurse individuals, treat them holistically, we could not do it without our chaplains. I think you all have a special skill with our vulnerable populations in some of their most vulnerable times. So thank you.
Okay. We also have a comment from Rhonda Green, Wynn. My experience with vaccinations, homeless was offered more of the J&J because of the one dose via mobile vaccination.
Yeah, that was absolutely correct, Rhonda. We felt like with the homeless population, we may only have one chance to help get them vaccinated. We didn't know if we'd see them again. And so we really we pushed the J&J when that came out, because that was a one vaccine, and you did very well with the one. So that's exactly what we did when we first started giving it to the homeless. And that was when I first mentioned it to you about 6 months ago. We were pushing the J&J a lot.
Wow.
So you're right on.
That makes sense. So there's another question I had, as far as if a person, as you're mentioning, don't delay if you need to come, thinking that you're helping what's going on with the emergency room. So how long should a person try to take care of themselves if they've been tested positive with COVID before they seek any medical attention?
That's a really challenging question, Sonia, because it depends how your symptoms are. If you've got the flu symptoms and you're managing, you're not short of breath, but you've got sniffles and a fever, then you could probably avoid an emergency room. But if you ever get that where you're short of breath, and that continues, and you're having trouble actually functioning on your activities of daily living, just walking around the house, then we would encourage you to come to the emergency room, because you may need. There's a thing called I think it's happy hypoxia, where people are okay, but their blood level.
I know some technology.
I think we disappeared for a minute. Yeah.
Okay, there I can see you again, Will. Sorry.
Yeah. No, thank you.
Okay, so in April, I took care of someone with COVID, and I did hear a lot about trouble breathing and chest pains as a sign to go to the emergency room. In this case, he didn't experience any of that. And day 4 or 5 into it, we were blessed to be introduced to Dr. Ewan Johnson. And what we found, we started working with him, is that his oxygen levels were very low, and he was actually lethargic, where I was thinking that, how they talk about the fatigue. Oh, you're just going to be fatigued, you're going to be tired, but just hang in there, you'll get through that, as long as you're having like the flu type symptoms. And so that's what I thought I was treating when I was caring for him. But what we purchased was an oximeter. And with that oximeter, that reading I gave to Dr. Johnson, and it actually sent up a red flag that really had that contact not happen that day, that he may not be here today with us. His oxygen was so low that they had to order oxygen for him. But the thing is, I believe that that's something they should talk more about. People should have as an oximeter at home. And when you're diagnosed with COVID, that's something you should also check. Check all your vitals, check your blood pressure. In this case, he was on blood pressure medicine and it dropped. So then I knew to stop giving him his blood pressure medicine, things like that. But I think having all the information is important. Like if you have to go to the emergency room, if they can be able to tell you, this is what my temperature has been, this is what my oxygen has been, will be informative, so you can further know how to treat them immediately to see where they're at, as well as knowing their history in general, their health history. What can you guys speak to what you feel is very important that they have when they come to the hospital as well?
Yeah, all of that information would be really, really great. It would help us understand how they've been progressing over those few days, and it helps the patient also understand, when they are going to be admitted or when they are being evaluated, just how they have progressed, and we can update them. We can give them our evaluation as well. What you mentioned about the pulse oximeter is a great tool. Sometimes they can be a little expensive. And so what some of our social workers have done is actually provide some of them for our patients who have tested positive, because not everybody is admitted. Some of them are discharged. And so we want them to be able to monitor this from home.
Yeah.
They still feel a little sick, but having the pulse oximeter really helps them. It gives them that warning sign, hey, it's getting really low. You should probably come back to the ED. And I remember when this first started, nobody could find them at Walgreens or CVS. They were sold out for quite a while. I've seen them, just walking around the stores. I've seen them, they're back in stock. But we do understand that not everybody does have the, $20, $30 to spend on them.
Yes.
So if you do happen to have that, definitely try and get one from your PCP if they can be even prescribed and ordered. That would be another option. But that is a very useful tool, Sonia. Thank you for mentioning that.
Absolutely. Well, we have come to the top of our hour, and it's been an amazing show. I've learned so much, and I hope our audience has learned a lot as well, too. Like I said, this is the first day of celebration of ER Nurse Week, and I, on behalf of Your Voice Talk Show and our audience, we would like to say we are honored to have you, and we're so grateful for the service that you and your colleagues do on a daily basis. And we will continue to keep you guys in our prayers, that you stay safe while you continue your endeavors on taking care of us and our community. And we will do our part. That's the whole purpose for the show today, is to let everybody know that we're all in this together. So we need everybody to get on the bandwagon and do your part. And we do have some 3 takeaways. The 3 takeaways are: number 1, the importance of getting vaccinated. Number 2, social distancing and wearing a mask still works and is very important. And number 3 is reaching out to your loved ones and friends as much as possible, because stress, as they say, is the number 1 killer. And a lot of times we think we're bearing with things and we're handling it, but it's really handling us. So self-care, mental health is so important. Give yourself grace, give people around you grace, and please check in on everyone. So it's been a great show. I mean, I've learned so much. And then next week, we're actually going to talk, and we're going to celebrate October is Breast Cancer Awareness Month. So we're going to talk about that. So, gentlemen, you guys have any last takeaway that you would like to share with our audience? Will?
Just a great show, Sonia, and thanks for having us on and helping us celebrate Emergency Nurses Week. That was very, very kind of you to reach out to us and let us join you. I look forward to reading your book, and I want to go to Barnes & Noble and look that up. And
Thank
but
you.
we really appreciate it. We know the community's stressed. Technology is evolving all the time. I think we're on a good path, and we're getting better all the time. And don't hesitate to go to the hospital if you need to, because that's not a good decision. If you need healthcare, you need to go. So thanks for everything, Sonia. I appreciate it.
Thank you so much, Bill. And Jonathan, do you have any takeaway words for our audience?
Yes. First, thank you, Sonia. I really appreciate you bringing us on board. I do have 3 takeaways, just like you. First one, get vaccinated. Second one, check the sources of the research that you are conducting. And the last one is be nice. Be nice to one another. Be nice to your community. Be nice to the healthcare professionals that are trying their very, very best to hold it all together and help as many people as possible.
Wonderful. I think that's wonderful things. But gentlemen, thank you so much. Thank you for bringing this, the professional, from perspective of bird's eye view to what's going on in the state of our emergency rooms. Thank you. You guys have a wonderful Sunday afternoon. And those of you who have tuned in, thank you for joining us. We thank you for your time. You could have done anything else. So thank you for taking the time to tune into Your Voice Talk Show. And we'll see you 2 weeks from today to talk about breast cancer awareness. Thank you. You guys take care. Bye-bye.
Thank you.
Thank you.